Jackson Street.
Jackson Street.
My mouse.
Oh, yeah.
They just got a shit.
Just click on it.
That's a little quaint little thing.
Uh-huh.
He buys brass back, by the way.
And he's very nice.
Yeah.
Is there a space bar?
Dog is.
Does it too.
It's pretty,
Want this on the front? You could probably put it where
My
it's
little guy
always.
just goes
He's not gonna have any ammo.
Sure.
You gotta take 41, you take a right on 76.
I heard you got guns for bullet
knowledge.
He's got no, he's got like 10% off. Shit ton of stuff that he's got.
It's a very, like, it's just him.
All right, impromptu training for tonight is opioids. So Narcan. Okay. Okay, so this is written for the EMR level, so for our first responders. So we'll improvise a little bit and add in the EMT, AEMT, and medical level for everything, because I'm sure we all are very familiar with overdoses and what we have to do for our specific level. So we'll just kind of go through it and talk through it, try not to do death by PowerPoint tonight. So we'll do our best. So setting the stage, what we're going to look at. So the case study introduction, because we always do a case study. So EMTs Turk and JD. Side note, anybody know what TV show that is?
Scrubs.
Good job. So EMTs Turk and JD arrive at the scene of a reported overdose to find a woman in her 30s slumped over a chair in the kitchen with drug paraphernalia in the area and concerned family in the other room. The patient appears unconscious, breathing slowly, and has a history of drug use. So what are the things that stand out to you right now? If you were to walk into that scene looking at that, what are you automatically thinking?
Scene safe.
Okay,
Don't-
BSI, scene safe, yes.
Don't touch the needle. Or anything else.
Okay, so drug paraphernalia. What are you going to be seeing as drug paraphernalia?
Needles, syringes,
Okay, yep.
tourniquets.
It can literally be anything. So what are some of the most common drugs that we're going to see in EMS? Heroin, yep.
Marijuana.
Yes, you can have marijuana.
Opioids, like just over the, or not over the counter, but.
You can have over-the-counter ones too.
Yeah.
It can be pill bottles. You can be walking in and there's pill bottles spread over and they could have overdosed on a bunch of medication. Are you always going to know exactly what medications they overdosed on? No. But you use clues in the scene to figure out what they took. If they're not going to talk to you, there's no family members, or the patient doesn't even know, because sometimes they don't know. And that went too far.
Done.
Apparently.
He's trying to play
Okay.
video.
Peace out.
There we go. All right. So, what are your opioids? So they can be natural or synthetic, work on the opioid receptors in the body. Includes illegal drugs like heroin, as well as prescription pain medications such as oxycodone and fentanyl. Morphine is one of them. They can be tampered with to be snorted or injected and can be abused when taken by mouth. So then here's just some information about, looks like 2019 counts of how many deaths, hospitalizations, ER visits, different areas in the state where it's a little more common ages. So we can go through that later. So after prolonged use of these substances, increasing amounts are needed for the same effects. So a lot of things we'll see when somebody overdoses. So a person that has been clean for how long they haven't been using it, their tolerance is now very low for what their body would take for getting the high effect. So when they start using again, are they going to start low and work back up? No, they're probably going to go right back to what they had stopped at. That's when you're going to see your overdoses. You're being called to come respond to these patients because they're used to taking that normal amount, and it will kill them right away instead of giving them that high that they want. So your common side effects: nausea and vomiting, drowsiness, itching, dry mouth, small pupils, and constipation. So those are the common things that you would think of. You would think of more respiratory depression, pinpoint pupils, unconscious, or not breathing. So heroin. So Narcan is only used for opioid overdose. So remember, that's for your morphine, your fentanyl, because those are opioids. So you're not gonna wanna use it on cocaine or LSD, any of those. So anybody seen the TikTok of the county officers? The new rookie going to respond to the unconscious, he's gonna give Narcan to a diabetic patient? Nobody's seen that one?
I'm gonna look it up now,
Because I was gonna find it and show it to my group on Monday. Because it was kind of humorous. But how many times do people give Narcan to unconscious patients that it could be a diabetic issue, it could be any other issue, but it's so ingrained into our head, unconscious, not breathing, overdose, right? Because sometimes there's no drug paraphernalia, there's no signs that would make us think that it's an overdose. So you don't want to use Narcan for marijuana, it's not going to work. So different treatment drugs, one of the biggest one that you'll hear about is methadone. I know there is a methadone clinic up in the Appleton area. I think there's one in Oshkosh. So who's at high risk for overdose? Yes. Geriatrics. Especially with geriatrics, why would you be concerned with an overdose with them? Pain medications? And why? Why would they overdose on pain medications?
They forget they took the medication.
Yeah, it's not that they're doing it on purpose, that they could be sad and depressed and want to do it, but most of the time it's an accidental overdose.
People are short-term memory.
So then you have the recreational users, the IV drug users, and those who are recently released from or transitioning from the drug treatment programs. Because those will be the ones that, yep, okay, I'm good while I'm in the program, now I come out, I'm back to my normal life, and it's so easy to just get right back into that. Yep, your elderly patients, and then kids who don't know what they're taking. That mom and dad don't take care of the medications like they should, and oh, well, mom and dad take this, why can't I? So then Narcan. So this will go more over just the IN Narcan. So it has a very low risk of exposure to blood, so you don't have a needle, you're not gonna like accidentally stick yourself. So that's why it is more of an over-the-counter medication where families can get it for people that will overdose so that they have it. It can be administered quickly, it's quick to start acting and very effective when it's used. And then talking about the nose, because it quickly absorbs the drugs directly into the bloodstream. So why is it used with an atomizer? So squirting the liquid drug as a fine mist covering more of the surface like spray paint or hairspray increases entry into the bloodstream. So the overdose signs and symptoms. So not responsive to verbal or painful stimuli, little or no respiratory effort. So we're looking at less than what is the effective rate. What is an effective rate for breathing per minute? Yes. Yep. So we're not seeing any chest rise and fall or just very little, or the cyanosis, so the blue colors, and pinpoint pupils. I've walked into a scene where the first responder goes, it is, what did he say, cocaine overdose. So I didn't give the Narcan. He has the Narcan sitting right in front of him. And he's like trying to putz around and get out of BDM. So my partner and I, we're both medics, we walk in, we're looking at this like, okay, he's not really breathing very well. We didn't see any like drug paraphernalia anywhere, but he looked like an overdose. And my partner goes, well, what do his pupils look like? I looked at him and I went, yeah, get out the Narcan. Yep, he responded very, very well to Narcan within just a couple of seconds. So make sure you look. That's the side note. So indications and your contraindications. So what would be an indication of using Narcan on an overdose patient? They're not breathing, or they're not breathing effectively. You're not sure, well, let's try it and see, because is there a lot of harm to giving Narcan to a patient? Not usually. When would the harm be giving the Narcan to the patient?
To give it too much, like,
Too much, too fast, you're gonna swing them from one direction to the other. So, contraindication would be an allergy. Are you really gonna know that the patient has an allergy? Unless they have it on their alert bracelet that they're allergic to Narcan, which you'd have to be doing something to know that you're allergic to Narcan, right? Okay, so the consciousness, alteration of consciousness or respiratory depression of presumed traumatic. and then nasal trauma. So, and then make sure that you let the incoming ambulance know that you gave Narcan if you're a first responder, because we really want to know that.
PD will let you know.
Oh, yeah.
2 down, 3 down, 4 down, you're like, man, we haven't even made a mile yet. Really? Must have ran out.
We didn't know it was an overdose until we gave it to them.
And that's why, when you're getting, what types of calls would you be considering? Maybe I should be thinking about an overdose in this. Unconscious, barely breathing, cardiac arrest.
Younger age maybe.
You could, yeah.
Even a
Car accident.
Yep. Unknown person down. Those are all things that go through your mind. That's why we can't have the tunnel vision going into things. We need to look at the broader picture, because it might not be what dispatch is relaying to you. It might be totally different once you get on scene. So adverse reactions, so the serious reactions would be VFib, cardiac arrest, and seizures, and the medic would be handling that. So common reactions are high heart rate, hypertension, hypotension, nausea, vomiting, tremors, withdrawal symptoms, diaphoresis, pulmonary edema, dyspnea, and we will handle them all as they come, right? So steps for administration. So you got your scene safety and PSI out of the way, but consider your ABCs. What's the biggest thing that you want to do when you have an overdose? Airway. So don't jump right to giving Narcan. We want to make sure that we are effectively breathing for them if they're not breathing. So then oxygen, your airway adjuncts. So if they're not effectively breathing, you're not able to ventilate well with the BVM, think about putting in an advanced airway, whether it's an iGel or a King, or even intubating the patient. Because it's honestly easy. We're not doing the RSI, we need 2 medics to do that. Because the goal here is to correct their breathing. We, as EMTs, you can handle an unconscious overdose by breathing for them, especially if it's a opioid overdose. Because what is the opioid doing? It is keeping them from breathing effectively, because it's blocking those receptors. So by adequately breathing for them, ventilating this patient, oxygenating them, you're maintaining everything that the Narcan would do. And is it easier to handle an unconscious patient or a conscious patient that you have taken from their nice high to angry, spitting, yelling, screaming, and now you have PD riding with you in the back, going to the hospital? That's what you have to be thinking about when you go into these scenes. So as first responders, PD is definitely trained this way, that you go in and you slam the Narcan. And how many of us have dealt with a patient that has been slammed with the Narcan, and now we have a very angry patient refusing any treatment? How long is it going to be before we're back there again? Because the Narcan only works for so long. So make sure that you're also always checking a blood sugar, especially on your unconscious patients, because it might not be an overdose, it might be a blood sugar issue. Alright. So you can assemble your kit. So obviously this is going through the nasal Narcan. So administering 0.4 to 0.5 milligrams. So protocol is written 0.5 to 1 milligram intranasal. I think we all know how to put it all together. If not, I put the kits out so you can familiarize yourself with them again. If it's been a while since you did nasal Narcan. Oh, there's a video. Okay, any questions about the PowerPoint? Okay, good.
Should do our trainings more often.
Well, we'll see
What if
about
my
that.
patient says he just took heroin and the officers just found out, and he's starting to go, he's sitting on my cot sleeping, wakes up, gets really sleepy again, can't finish a sentence, starts really snoring respirations, all that fun stuff. Is that a time I give Narcan?
Did he say he took heroin?
Yes. Mits to half a gram 30 minutes ago.
How's his respiratory?
Yes.
That's where we're going with this. Okay, it's 8. When he actually falls asleep, it drops down to 4.
That's what our capnography call it.
Stern.
Put in a nasal.
Yep, every time you do painful stimuli, it comes back up. Ow, don't do that. Yeah, nasal airway, oral airway. Are these patients that we're gonna give Narcan to?
Eventually, maybe.
Maybe, maybe not. Are we here to kill a high, or are we here to make sure they stay alive to the hospital? So if you can use all your other stuff, you don't necessarily have to give Narcan. These are also the patients that'll say they're allergic to it, because they're usually the chronic users and they don't want you to kill their high. So, not that we can do much, but people say they're allergic to Narcan all the time.
I'd be impressed if you had a guy in Narcan in the cot who said he'd go to the hospital.
That too.
Yeah, I've sat unseen for hours trying to talk to patients to get them to go to the hospital after giving them Narcan.
That's why
That's-
you put them on that rig first.
Yes, yes. That's why
Start driving.
And drive.
if you have to, give them a little bit of Narcan and bring them back just to effectively breathe, and then we can move them. The last one that I Narcaned, it was just my partner and I. We were out in the middle of the county. We had 10, 12 minutes before officers responded. So yeah, we were this close to starting CPR on him. We gave him Narcan and sent him into a ventricular rhythm and shocked him. But we got him back, and then after talking to him, he was willing to go to the hospital with us. So you do what you gotta do.
Are you gonna go or not?
You can about 30 more seconds.
No, what?
This is
Wrong
probably worse
answer.
than taser.
You're now going to the hospital.
So, as a paramedic, when's another time that you could use Narcan? Not on a real overdose. So the patient didn't take the medication. Why would you be giving Narcan in the back of your rig?
You over-administer the meds.
What medications?
Fentanyl, morphine.
Mm-hmm. Because we can be giving a standard amount because we can give, 50 micrograms of fentanyl up to 200. After that, we have to call for orders. But sometimes we can have a patient that we're giving them a normal amount that we think that they can process pretty well, and they just get a little too stoned. And we have to give them Narcan because we
Or
overdose them a little
capnography, that's a quieter ride.
bit. Do that too.
Until they're not breathing, period.
That's why the capnography, yeah.
Then you just deliver them to the hospital, like, no, he's just sedated a little bit, he'll be fine, just breathe for him every little bit. Every 6 seconds, squeeze that back, we're good.
That was pretty bad.
Yeah, hospitals don't like that if you bring them an overly sedated patient that shouldn't be sedated.
If you really don't like the hospital, you give the rest of your Narcan just as you're
In a
walking to the
line.
door. Here you go, he's awake.
Put it in a line.
Alright, any other questions, any other stories, any other anecdotes? Nothing? Alright, if there's nothing else, there's your training.
Set up, plug and out.
You gotta do it with serious.
Oh, there you go.
Wow.
Spicy. What's wrong with you? That was only